much of this are you seeing now?
Unfortunately, far too much, and it is very like ME. And what worries me, I think, perhaps most of all, is that ME can be an incredibly debilitating condition and can last for years. Now, what we're seeing is that 2/3 of people who have long COVID have symptoms which are having a significant impact on their lives, and 1 in 5 of them, that's almost 250,000 people just in the UK, have got symptoms which have completely revolutionised their lives for all the wrong reasons, exactly as Katie has. The only thing we don't know yet is how long that is going to last. And unfortunately, if ME is anything to go by, it could be a very long time indeed.
Now, Casey's saying, urging people to get the vaccination. Now, what we do know is even if you have 2 vaccinations, you are double jabbed, you can still contract COVID. Well, what is the protection in terms of, I don't know if any data is out yet, obviously we're still in very early days, in terms of being double vaccinated, contracting COVID and long COVID?
We don't yet have enough data to know how much of an impact it's going to have on long COVID. What we do know is that you're likely to get a lower dose of virus if you, for instance, continue to socially distance, if you wear face coverings and so on. And we know that having long COVID is more likely, for instance, for health and social care workers, for people who get a very high dose, if you like, of the virus. So it stands to reason that having the vaccination is going to reduce the dose of the overall dose of the virus you get, because your body will be able to fight it off much more quickly. And therefore we believe that we may well be able to reduce the risk of long COVID.
And of course, as you made very clear, we're in early days, so we don't know kind of in terms of treatment. If someone comes to you, Dr. Jarvis, and says, I have long COVID, I had COVID, I know, 10 months ago, and I'm still struggling, what can be done?
It's very difficult because, as you say, we don't have that much in the way of treatment. Ironically, the NICE guidance on ME has just been delayed, their draft guidance, because there is still, all these years on, no consensus on what is the right treatment, the best treatment for people with ME. What we do, however, have now is a much greater network, in England at least, of long COVID clinics, specialist long COVID clinics. There is support available in Scotland, Wales and Northern Ireland, but there are no specialist clinics available. And in England, they're actually setting up 15 children's long COVID clinics because children are getting really severely affected by it as well. And that's where they have multidisciplinary teams. So it will be a combination of doctors, physiotherapists, psychologists, occupational therapists, people who can help with rehabilitation, and they're working together to try and improve care.
Just in terms of data, as we were saying, early days in terms of this pandemic and medical research, antibody therapy, it's been approved in the UK. Could you briefly describe what's happening?
Yes, so this is Romprev, which basically is what's called a monoclonal antibody, otherwise known as a designer drug, if you like. And there are quite a lot of them which have been developed for a wide variety of conditions, often conditions called autoimmune conditions, where your body turns on itself. In this case, Romprev binds to the virus that gets into the respiratory system, and that stops it getting into your body. It has been used to prevent symptoms, and it has been used effectively to treat people, perhaps most famously Donald Trump. The issue we've got is that it is very expensive, and therefore we can't give it to everybody who might catch COVID. But what we might be thinking about doing perhaps is giving it to people who are at very high risk of serious complications if they get it.
And Sarah, a quick word, we're talking about children, obviously, going back to school in a couple of weeks. There's a £25 million order for carbon dioxide monitors. It's yet to be finalised, but it's in the pipe work. How important is this? This is to go into schools to improve ventilation as well.
Because we tend to think more about carbon monoxide monitors, which are so important for preventing poisoning. But CO2 monitors, carbon dioxide monitors, give a good indication of how much ventilation there is. And we know that hands, face, space, fresh air was added, I think, about 9 months ago now, for exactly the reason that we are becoming much more aware that circulating air really does reduce the risk of the virus. Of course, So do things like the COVID app, and so do, even if you're double jabbed, getting yourself tested if you are pinged. All these things, we've got to stop pretending that it's gone away. We've still got 1 in 80 people in England who've got the virus at any one point, 1 in 130 in Wales, up from 1 in 200 last week, and 1 in 55 in Northern Ireland. This virus hasn't gone away yet.
No, OK. It certainly hasn't. Dr Sarah Jarvis, thank you very much as ever for your time.